Welcome to SSPTV Community News. I'm Lisa Sugart. Today we are here at Lehigh Valley Hospital in Hazleton, where 5 years ago, Apollo, the surgical robot, was introduced. Today we return to see a new upgraded Apollo 2 surgical robot and an additional orthopedic robot. Today we'll take you inside to show you how these procedures are benefiting the greater Hazleton area. I'm pleased to be joined by Dr. Michael Mahoney right now, who has been working with the robotic surgery for quite some time. Dr. Mahoney, tell us how this all got started, because this is 5 years now that this is happening here at Lehigh Valley Hospital.
So again, just the need in the community, and as we developed our skills here, we needed more technology. So we started with one of the earlier generation robots about 5 years ago, like you said, and about 2 years ago we upgraded to the most recent and most advanced robot.
So how many surgeries have been done with robotics since this started here in Hazleton?
I'm at about 500 cases myself, and I'm not certain the total number for the whole hospital, but I think we're over 600 or 700.
So now when you have a patient, how is it determined that they are a candidate for robotic surgery?
A lot of it depends on what surgery is being performed, as well as the surgeon's preference. I think are kind of the biggest factors into it, but it certainly is something discussed with the patient. It's a joint decision.
What are the benefits of using robotic surgery versus the typical surgery?
So robotic surgery offers patients an opportunity for potentially a quicker recovery and a less painful recovery. There's also a lot of benefits from the surgeon side for ergonomics and dexterity in the OR.
So now, when you talk to the patient about this, are they hesitant at first when they think robotics? Do they think you're not doing the surgery that a robot is?
I haven't met a lot of hesitancy, but there are a lot of people that think, oh, you just kind of plug a quarter into the machine and it works, but that's actually not the case. The robot is completely controlled by the surgeon. So the robot is basically just an extension of my hands. Think of it as a tool and not a machine.
And you're getting a better look thanks to technology?
Yes, basically the camera system is like a virtual reality camera. It's a three-dimensional image, and it's also very sharp and with great resolution. So there are 4 potential arms that you can use with the robot. One of them is taken by the camera, but you have control over all 4 arms as a surgeon. There's different pedals that you can control, and that affects which ones are being controlled by your hands. So you can control 2 arms with your hands at one time, and then there's a static arm and a camera arm. But you have control over all 4 of them ultimately.
How long did it take you to learn how to utilize this?
I think I caught on pretty quickly, but I grew up with video games, so that was probably part of it.
Was that a plus?
I think so.
What has improved since the first generation of Apollo to the new one?
A lot of the technology has changed in the camera system. When it first came out, 4K and above was not an option. Now it is. The other changes is just the instruments have gotten stronger, sleeker, and just better dexterity, and also too with different technologies have improved, such as a stapler, as well as the energy dissection that we use.
My recovery time then is much less because I've had this robotic surgery as it would be with laparoscopic?
Potentially, yeah, and it would be a quicker return to pain-free activity as well.
Dr. Joshua Knockomson is one of the physicians utilizing the robot here at Lehigh Valley Hospital, Hazleton. Dr. Knockomson, tell us, how often do you utilize the robot?
Well, we try to use it as frequently as possible for routine elective cases here, and that would include patients who are coming to the hospital with problems with their gallbladder, with their colon, hernia surgery, and sometimes we'll do bariatric surgery here using the robot. So it has multiple uses here, and the goal obviously is to improve patient recovery time and pain control after surgery. It's really affords a lot of advantages with respect to getting patients out of the hospital more quickly and bringing them back to a normal quality of life sooner.
What is the difference between doing it normally or doing it with this? Do you get to see things better?
So the technology is pretty impressive. It gives you a visualization that you don't have with other operative techniques. So standard laparoscopic techniques are basically limited in terms of your field of view. You're looking at a two-dimensional screen, an operative field. With the robot, you actually have a three-dimensional operative field. So for small spaces in the body, it gives you superior visualization, and that improves the dissection and less pain, quicker recovery.
What are the benefits of me going with the robotic surgery as opposed to the regular surgery?
Well, it depends. It depends on the surgery, but for many cases, you'll notice that the pain control after surgery is much better. So in many cases, we don't give pain medication. We'll have you use over-the-counter pain medication for recovery from hernia surgery, gallbladder surgery, sometimes even colon surgery. So even the bigger cases, I've seen people sail through them without much discomfort. And then the incisions are smaller, and you'll feel more like your normal self more quickly than with other types of operative procedures.
How difficult was it to learn how to utilize this?
There is a little bit of a learning curve for sure, but when you're trained in other forms of surgical technique, the basic principles are still the same. So it's not that much of a stretch to learn this compared to other surgical techniques.
What's been the feedback you've gotten from your patients who have had it?
I think initially, in the beginning, they're a little apprehensive. They're worried that the surgeon's not actually doing the surgery and it's the robot that's doing the surgery. That's not really the case. But yeah, many of the time, they're amazed at how well they feel in a relatively short period of time. I've had people come to the office and say, yeah, I only needed Tylenol or ibuprofen for 2 days, and then I was fine. I felt great. So it's really, it's superior surgery, and I encourage people, if you need surgery, this is a great technique and approach to do it.
What's the percentage of versus how many you do with the robot as to the regular?
Well, it depends. Most of the elective procedures that are eligible, we try to do with the robot. So, I mean, if you're coming to the emergency room with a major, acute or emergent problem, that's probably not a situation we're going to use the robot for. But for an elective scheduled procedure, we'll try to use it as frequently as possible.
So again, the types of surgeries that it's used for?
At this hospital, it's used for basically hernias, gallbladder surgery, colon resections, bariatric surgeries, surgeries on hiatal hernias, foregut surgery. So it's got a wide spectrum of operative cases that we can utilize it for.
Dr. Anthony Corrado is another of the surgeons utilizing the robotic surgery here at Lehigh Valley Hospital, Hazelton. Dr. Corrado, how has this been for you? How thrilled are you to be using robotic surgery?
Oh, I'm thrilled. I've been doing it since 2011. I was very excited when the hospital bought the robot a few years ago. It's been wonderful. It gets patients in and out of the hospital quicker and much less pain.
Now, about how many surgeries have you done using this?
Probably around 150 to 200.
And overall, do you see that it's less time to use the robotics or more time, or can't you tell?
It's less. It definitely speeds up the time of surgery. Once you have a technique and learn how to do the procedure, it really speeds up the process.
How long did it take to learn how to utilize this?
Initially, it takes a while. Initially, there's a lot of courses you have to go to. I wasn't trained during residency on the robot, so I had to attend courses and do a lot of simulations.
And when you have a patient, how do you determine which patient is suitable for this?
Most are. A lot of it's based on prior surgical history, the size of the patient, the procedure that needs to be done, but most are.
What compare for us doing a normal surgery versus doing it robotic? How much better is it? Are you seeing everything more clearly?
Well,
Tell us about it.
The optics are phenomenal with the robot. You can get centimeters away from the site you want to look at, and the fine maneuvering of the robotic hands and arms makes things very detailed. You can definitely see a lot more than you can without.
Are patients skeptical when you say, we're going to do robotic surgery? What's the reaction you get?
Most of the time it's positive. most of the time it's positive. They're excited that it's a newer technique and it can reduce their pain and reduce their hospital stays.
Much smaller incision?
Smaller incisions, absolutely.
For laparoscopic, sometimes there were multiple sites. Is that the case with this?
There's still multiple sites with this, but the incisions are small, and the advantage of the robot is that it puts the access point of the instrument right at the skin, so there's less torque at the skin, causing less pain post-operatively.
Is there anything you're doing differently than you would doing normally for a surgery?
The only thing I do differently is once the robot is docked to the ports, I step away from the OR table. With other cases, I'm always at the OR table, but initially it's a little, it's definitely a learning curve to walk away from the table and go sit at a console on the other side of the room.
Does the other staff then also have to be trained as well for this?
Yes, the entire OR staff has to be trained, the nurses, the techs. If there's a physician assistant available, they're trained on the robot.
So how do you think Hazleton area compares with other facilities then in utilizing this?
We're second to none. We're right up there. We do everything that other institutions do.
And it was that fact that brought Dr. Anthony Falvello back to the Hazleton area to perform surgery.
So this is our VELOS robot. This is by the DePuy Synthes company. We use this to perform robotic-assisted knee replacement surgery. So we're going to do a little movement here. We'll see if we can get the robotic arm to move. And you can see, normally a patient would be laying on the table. The robot's going to go into position here and tell us where to make the appropriate cuts on the knee replacement so as to position it. The robot has a full range of motion, approximately 180 degrees, that we can position the saw in any position. And if the patient were laying supine on the table, we would use the saw like this to make our appropriate cuts. And that's how we know that we're putting the knee replacement in very specifically and under appropriate tension. So it's quite a useful tool. It's a very useful tool.
Dr. Falvello, what is the recovery time for robotic surgery versus your typical surgery?
Typically, robotic surgery recovers a few weeks sooner. Because we don't have to cut as much of the soft tissues to balance the spaces in the knee, there's less damage to the soft tissues, which provides the patient with a quicker recovery. So on average, we have patients that use a walker for a week, maybe two, then a cane for 2 weeks after that. But most people are returning to walking for exercise or golfing at about 2 months.
Have you had a patient that maybe had a normal knee replacement and then they went and had the robotic on the other leg?
Yes.
What was the comparison?
Yes. I've had a few of those, and every patient has said the robot was the way to go. Much easier recovery, and that they, even quite a few of them said that it felt more like their own knee, which is what our goal is. We're trying to reproduce anatomy very anatomically and as best we can, and the robot gives us the tools to do that. We've had excellent results. We've performed several of these surgeries here. I myself have performed many surgeries robotically. I was from the Hazleton area. I left for a few years, got some training in robotics, and then came back and brought it here. Lehigh Valley Health Network made a huge investment in this robot and other robots to bring orthopedics to the forefront here in Hazleton and in other areas the network provides. This is an exceptional tool for providing a very reproducible and good result with knee replacement.